we have that ability to apply some of that pressure because we have the purse strings, as the gentleman was saying earlier. That's where you can get the power to really get stuff done on the ground. But there's more that we can be doing, for our veterans to help end homelessness and give them an opportunity. It's why Congressman Cardenas sent a letter to President Obama this fall urging him to have better transition services for our soldiers as they come back. And that's largely on financial literacy in particular. Right now, if you're a soldier and you're on your way out, you have your transition out programs, which, you'll have the slew of different courses you have to take and different boxes you have to check to get out. One of those is financial literacy training, but, the reality is that shouldn't just be a singular opportunity. It should be an ongoing education because, these are folks who are out in the trenches and have had a lot of different challenges, and we need to make sure that education's there. So our office with a couple of our partners in Congress are doing a review on that to make sure that it's actually realistic in terms of the services the government's providing. In addition, the Congress is working with a couple of representatives from California, Representative Brownlee from shortly up north in the Santa Barbara area, and Scott Peters from San Diego on different veterans reintegration programs. Those focus on not just stepping in for the veterans who are at risk of homelessness, but also the elderly homeless to help find a solution, make sure those resources are there, and really update our policies. Unfortunately, a lot of this stuff is far too out of date and unresponsive to some of the needs on the ground. But bringing it back further, the best way to help our veterans and end homelessness of our veterans is give them a job. And that's why this fall the Congressman introduced Honoring the Hiring of Heroes Act. This is legislation that's going to incentivize businesses and employers to hire veterans. So that isn't just the soundbite, I'm hiring veterans. Let's create an awards program. Let's create some incentives to actually get our veterans hired. And that's one step in the process. You have to help the folks who are out there and struggling, but let's end that path to poverty. Let's close that road so that we can help the folks who need it, and we don't have a continuing flood of folks going into that situation. In addition, our district office is going to put together a guidebook on veterans resources that we hopefully can share with you all and make sure that gets out in the community, because there are a lot of programs out there. There are some resources in place, and unfortunately, we're not taking advantage of that enough. There are funding streams as well on the federal level that Southern California and LA in particular isn't taking advantage of. We probably get 60 cents on the dollar of the federal money we pay in taxes, and a lot of times that's because we're not coordinating how we apply for funding and how we apply for resources. And so, we could all do better on that, and I think that's why convening folks together like this is a great opportunity to have that to start that conversation. More broadly on the issue of homelessness, it goes back to the all-hands-on-deck approach. We're far too great of an economic power to have homelessness still plaguing too many of our communities. Far, far too great of an economic power. The Obama administration has its own policy in place, the Opening Doors policy, which is meant to start to integrate some of those resources, but a policy is a reality unless there are folks on the ground bought in. And so, again, that's why it's great that you all are here today, and we'll make sure that we get my information out to folks and our team's information so we can hear from you all what works, what doesn't work. Because there's going to be a lot of benchmarks the administration is going to put in, and that's going to drive a lot of the money and how it goes, but is it real? Is it working? And that's the question that we should be asking, like the gentleman was saying earlier. What works, we got to fund. What doesn't work, we need to maybe reorganize a little bit and have a conversation on how we can get it to work. Because it goes back to the whole point. We can set goals, we have to find ways to actually reach them. And on that point, Housing Secretary Julian Castro last month stated that we're on track to end homelessness in the U.S. by the end of next year and chronic homelessness by 2020. Very ambitious goals with significant federal resources behind them, $5.3 billion on the federal level in the budget for targeted homelessness assistance. But again, even though with that increase of 21%, we have to figure out what's working. Are we spending it right? Can we do better? And where do we need more resources? Because that's probably not enough given some of the realities on the ground. That's just both the folks that are homeless and the families that are out there, as well as the people on the brink. Our economy is still struggling, and so how do we stop the folks on the brink and, once again, close that path to poverty that's hitting too many communities, especially in this area? Sorry, going over many notes. More broadly on these issues, the congressman's big priority over the years, as some of you might be familiar with, juvenile justice issues and education for our youth. And that goes back into what can we do to make sure that our youth, especially those at-risk youth, don't get in a situation where they're not getting the education, or if they get in trouble, they can't get out of the system, and largely they're not getting the mental health services they need, and then put them on a path where it's going to be difficult, where you make a mistake, you can suddenly find yourself on the streets. And so on the state and federal level, he's worked to get dollars leveraged towards different programs. On the federal level, that's one of his goals as well. Most recently, he joined the House Energy and Commerce Committee, which is the big jobs and business committee in Congress. And I say that in the relevance because, going back to the point, we end homelessness by making sure people have jobs, in particular well-paying jobs. That's increasing the minimum wage. That's making sure there's a living wage, but that's also making sure that we keep these jobs here and don't have them go overseas. And so one of the big priorities this next Congress for the congressman is, how do we create more jobs? How do we support the economy? How do we get folks the job training they need? Because things aren't changing, but if someone falls in a bad situation, that shouldn't be the end of the day for them. It should be the fact that we have job training resources available, we have education opportunities available, so that we can make sure that no one's in that situation where one circumstance of bad luck leads to years of bad luck. In addition, on the Energy and Commerce Committee, something we're going to have to deal with this next Congress is healthcare policy. And largely that's making sure that the Affordable Care Act remains law, has the funding it needs. There's a significant amount of resources there for mental health services. Making sure that everyone has access to health care is another way to make sure that we end homelessness. The reality is, over the past decade, too many families have lost their homes over health care expenses. You get sick, you lose your home. That's not who we are as a country. I think we can all agree on that. And so what we need to do going into that next year, and now is in this role in this committee, is to help make sure we have that conversation. Let's make sure the safety net is strong enough so that people can get to work and have that opportunity. And again, not have that situation of bad luck leads to a really bad situation. Lastly, our district office is going to be working on the youth point and count time this January. That's the counting with different stakeholders of the youth homeless population. I'd encourage folks to really get involved in these efforts and partner with us on that. That's how we get our information on the federal level. Is the youth point in time count in January? Because on the federal level, it does come down to the dollars, and we need those. We need the stats. We need the facts. We need to be able to argue that, and that's the point of, if there's a good program, let us know what works. We can help promote it out there. We can help host a briefing out here. We can help host a briefing in Washington, D.C. Because then we can hopefully convince some of our colleagues in both parties, let's fund this. Here are the numbers. When you don't have enough of an undercount in these programs, it becomes even harder to get the money. And so that's what I'd like to hear from folks. What's working? What can we be doing better in Washington? Here particularly to learn. I think that's the most critical point of all this. So thank you all for your time. I can pledge to you the Congressman's going to fight for this priority and make sure we have the budget resources. And then, more broadly, make sure that our community has the jobs and economic viability so that we can have additional local resources to get it done. So, happy to answer any questions.
May we go? Yes, thank you, Sam. Questions in the little room so we can roll on
little
this
room?
on it. Yes.
Perfect.
Thank you, Mr. Jamal. Thank you for coming out. All right, up next we have Dr. Sheff and Bonnie Roth. I saw, there we go. Hi, ladies.
Hi, thank you very much.
Having us.
Of course.
We want to thank the council, thank you very much. And I think I'm Dr. Adrienne Sheff, and this is Bonnie Roth, and we're with San Fernando Valley Community Mental Health Center. And I think what I'd like to start off saying is that what distinguishes us from the other distinguished guests so far is that we are here in Van Nuys. We are your local homeless provider. We are your local veterans homeless provider. We have been, as a center, we have been serving the mental health and community needs, housing and vocational, as well as mental health and those with chronic homelessness and serious mental illness. We have been serving this community for 40 consistent years.
Wow.
In the early, well, Bonnie and I both came to the agency about 18 years ago. We had a homeless drop-in center prior to that. It was a little shack on Van Nuys Boulevard. Actually, it's the Psychic store now. And we took one look at it and said, you know, we're committed to dealing with homelessness, and that's what we want to put our energies into. And so now we have a really beautiful, large, some of the people know about it here, facility in right in Van Nuys, a few blocks from here, called the Cornerstone Program, which, oh, it's a little doggy here. Oh, what else could make me do that? You know, fall over, right? The Cornerstone Program is has been working with everything from street outreach to permanent housing, using the Housing First model, and it's just an amazing place, and hopefully provides all the support and services, except for the physical health, and we work very closely with our other collaborators in this area, including LA Family Housing, Northeast Valley Health, etc. So I'm going to let Bonnie talk a little bit about the actual services of Cornerstone.
I just want to say something before I begin. I've been in the Valley working here at the Cornerstone Program right around the corner for 20 years. And I need to acknowledge the Van Nuys Police Department. This is by far homeless, mentally ill, and thank God we do not have to call them that much. We can contain things within our program. But this is the most qualified group of individuals, men and women, who know how to work with the mentally ill. I am never scared when they have to go out on a call, when they are called to my building, and I can also tell you this. For the past 15 years, they call us to go on outreach with them. We have developed great relationships. We go out on outreach, we have done ride-alongs, we have spoken to their police roll calls, and I think we are blessed in this community, and I just had to mention that. Because with so much going on, I need to applaud the law enforcement in the Van Nuys district. So thank you.
Yes, we all love it.
I just need to say, and I'm going to be brief, when I heard the mayor's, I don't know, were you the mayor's representative? Yes. I was very, very impressed because the mayor is right on. What is needed is housing. Doing this for 20 years, and I'm impressed by you also. I wish when you first became homeless, you walked into our doors and you had a whole different experience about the mental health system. I know the Department of Mental Health in our service areas here tonight. They are very involved in the issues of the homeless, mentally ill in this community also. What I do want to say is, though, housing made the difference. Service Area 2, which is the San Fernando Valley, is a very close group of service providers. We are one of the, I will have to say we are one of the best in the Los Angeles County. We have been working together for over 18 years. That's homeless providers, housing providers, mental health providers. Give me some more. Veteran services. I mean, I guess when LA Family comes up, they will tell you about how well we all work together. They are also going to tell you about the CES that we have in the spa, the coordinated entry system. That has made a difference. And I'm just going to say this, and then I know everyone else will be able to further on what we're saying. 15 years ago, you couldn't get a homeless, mentally ill client into housing until they jumped through every hoop there was. They couldn't be using. They had to be engaged in taking medication. They had to follow rules. They had to show up at your program. This all changed, I would say, 5 years ago, about 5 years ago, and they started looking at the homeless, mentally ill different, and they started looking at homelessness different. And housing is what does it. But it's not just putting a homeless mentally ill person into housing. It's intensive services, it's home visits, it's bringing them into the community, engaging them in where they live, knowing their neighbors, working with their landlord. Because the homeless, mentally ill, the chronic, that have lived on the streets 10 years or more, they need the intensive services that we all provide. And I'm going to end with that. Adrian, if any of you want to come out and visit the Cornerstone multi-purpose drop-in center, I will invite you, because it will open your eyes about what professional mental health workers and peer advocates can do with the homeless mentally ill. We have 13 programs, all which serve the homeless, and mentally ill, including veterans and older adults. They all congregate in our building.
Including those who are substance.
Oh, and substance abuse is 90% of our population. So I would like you to come and see what professional social workers, marriage and family therapists, drug and alcohol counselors, peer counselors, nurses, doctors who are dedicated to this targeted population can do. There can be change. We have to have more housing done, and through CES, which John Horn and Christina will talk about, we are able to get the most vulnerable into housing. Client comes in, we assess them, and they're automatically on a housing list while they're with us and getting medical, mental health services, case management, and everything else that we offer. Did I leave anything out?
I don't think so.
That's it, that's all I wanted to say.
Bravo.
Apologize in advance. I have an 8 o'clock presentation.
You're all good.
A few minutes early, please understand.
All right, up next, we are going to have Dawn Lestrange. Dawn helped plan this summit. This was his brainchild. He is a volunteer with the LAPD, and he's the Homeless Committee Chair of our Community Police Advisory Board. So we couldn't have done it without you, Dawn, and the floor is yours, sir.
Yeah, thank you. Welcome, everybody. Let's see, and I'd like to thank George also for, and the council for putting this on. And the speakers, I got blown away by Philip's comments and where he's at. But I really like the term of neighbor for a homeless person. And it does make sense, economic sense, to get people into housing. But I got a little prepared, thing here. I'd like to, first of all, again, my name is Don Lestrange. I'm a member of CPAP, which is a Civilian Police Advisory Board in Van Nuys Division. And for those of you that don't know what CPAP does, it's basically, we form committees to take a look at problems within Van Nuys and our division, which goes under Sherman Oaks and other areas also. And we form committees like the Rejuvenation Committee and the Sex Trafficking Committee and the Homeless Committee. And the goal of my committee, the Homeless Committee, is to solve some of the issues that are negatively affecting our community as a result of homeless and mental health issues of the homeless in Van Nuys here. I started working with Tom LaVanche's office about a year ago, a working group to come up with a solution to the homeless issues we're having in Sherman Oaks along the Boulevard, Ventura Boulevard. And what came out of that was a homeless initiative. The Sherman Oaks Homeless Initiative was partnered with LA Family Housing to bring their outreach into the streets of Sherman Oaks to start doing the work needed to get the most chronic and other homeless into transitional housing. And after providing the housing, they can focus on other services like mental health issues, job training, and other issues. What I've been working on with my committee in CPAP is forming a partnership with PATH organization, a nonprofit based in LA here, to start doing the outreach work necessary to provide services to those homeless in our community that want them. And that's part of the heartbreaking and challenging task, is to convince the homeless population that they should accept the services from the providers. and change their lives. And that's sometimes it's particularly hard hard to do for the homeless. We have a problem in Van Nuys that's gotten out of control, and LAPD can't force people off the streets. It's not against the law to be homeless. That is why I agreed to help make some changes and put an initiative together to start dealing with the homeless population here. And we're hoping to partner with PATH to start providing outreach and other services as soon as possible.
John, can you speak to this tiny?
Sure, yeah.
Speak up.
I know this seeks funding, and we're hoping that a coalition of all the governmental, nonprofits, business and faith groups, and others to help formulate a plan to start dealing with the issue. And that will take some work in hammering out the details as to how to make it happen. And I am confident with all the focus and attention on the problem, we as a community can make some positive change and progress in dealing with the homeless issues here. And that is my goal for the coming year, to make a difference in Van Nuys and to start working on our problems and have some success one person at a time. That's it. Thank you.
Thank you very much, Don. Up next, we have Anthony Gonzalez, a representative with Village Family Center. Mr. Gonzalez, the floor is yours, sir.
Thank you. Good evening. My name is Anthony Gonzalez, and I'm the program manager for the Village Family Services Tay Drop-In Center located in North Hollywood.
My name is Evan Sidroff. I'm the Caroline coach at the Drop-In Center.
My name is Rebecca Grande. I'm the program manager for intensive care and foster care.
The Tay Drop-In Center opened up in April of 2013, and we serve the transition-aged youth, commonly referred as the Tay population, ages 14 to 24. Transition-aged youth are individuals that are transitioning from adolescence into adulthood. It's a difficult population to serve simply because most of the time they are overlooked and have been passed away. Most of our clients are unaware of how to progress to that next step. And so that's one of the things that the Drop-In Center does very well, is to help them connect them to available resources.
And a lot of these transitional age youth are coming from foster care. And as we know, about 50% of them will more than likely be homeless within 2 years of emancipating. So there have been some changes in laws from AB 12, which is extended foster care. So we as service providers now have a couple more years to help them transition. We know that at 18, no one becomes an adult on their date of birth, but actually need that support to transition basic resources. And as a foster care provider, we're very fortunate to have the Drop-In Center as a one-stop shop to really offer these transitional services.
So the Drop-In Center, basically what we do is we help connect the Tay population to appropriate referrals and supportive services. Case management is offered on site, vocational support, educational support, art and fitness classes, life skills training, counseling services, peer and support groups, LGBTQ support, housing referrals, substance abuse recovery referrals, supportive services for the homeless youth that we do see, and also transportation assistance. What we're basically trying to do is prevent the next stage of young people into becoming that homeless population. Some of the overarching goals that we have at the Drop-In Center is to create a safe space for these individuals to come. We do a really good job of being able to connect with the individuals when they first come in, to be able to build that rapport with them so that we can move them and progress them to that next positive step in their life. Services are individually tailored to meet the needs of each one of those clients that come in. Think of the Drop-In Center almost like an emergency room triage, where we never know how they're coming in, but we have to be ready to meet those needs as they come in. Typically at the Drop-In Center, the top 3 needs that we usually see deal with education, housing, and employment. Where we're located at, we are co-located with the Valley Community Healthcare's Teen Clinic. They serve ages 12 and 19 years old. They have a primary health care clinic and a sexual health care clinic. It makes it very easy for us to be able to walk over any one of our clients who has any sort of medical need. The clinic serves between 3,000 to 4,000 young people every year. And being co-located with the Teen Clinic makes us the first drop-in center in the country to do so. One of the great things that we also do is reach out with a lot of collaborative partners. We find that the more people that we can bring to the table to help these young people progress, the better off that they're going to be. So we have a whole list of community agencies, both in North Hollywood, Van Nuys, LA. Again, we never know who's going to be coming in, but as soon as we have someone that has a need, it's up to us to figure out who's providing what type of social service in the area to be able to connect that young individual. It's a free program, open Monday through Friday. We are very low barrier, meaning that we don't have a lot of paperwork in the beginning. So what we like to do is have someone come in, get used to the staff, have an understanding of who we are and how we operate, so that we can build that rapport with them to be able to get them to that next step. It's very fast-paced, as you can imagine, dealing with 14 to 24-year-olds. But at that same time, our staff does a really good job of being able to connect with these young people in order for them to be able to trust us and open up and have us guide them to that next positive step in their lives. Again, we are here to serve the same population, sometimes overlooked. We are a newer program, but we've been around for a while. So the Village is a mental health and wellness agency that has been in North Hollywood for about 15 years now. At this point in time, I brought Evan here with me. Evan is one of my staff members. He's our peer life coach at the Village Family Services. He is a client of the Village as well as a full-time staff member. He has been with the program since the inception of the program. And I wanted him to talk to you a little bit more about his experiences growing up.
Hi, I'm currently 19. I've been in the foster care system for over 19 years. Due to AB 12, I'm allowed to be extended. If AB 12 wasn't here, I'd be homeless. I don't have family. I was homeless before. I had nowhere to go. And all I needed was a place like the drop-in center. To go somewhere very low barrier. They don't ask me questions, where are you staying, what about this, what about your parents, what are you doing outside the drop? Very low barrier. We want them to understand that they're welcome here, they're safe here. They can get away from all the negativity, and we can help them move on to the next step. That's what we're here for. We're here to make sure that they're willing to go and make sure they have the resources provided. I know firsthand, and that's why it's so keen to have a peer work one-on-one with other peers, is because a lot of them don't want to talk to someone that they feel like is just going to judge them. They want to talk to someone that makes them realize, I've been in your shoes, and I want you to know there still is hope. We're not looking down on you. We're here to help you. There's always hope, and there's always someone that does care. And that's what's so important about the drop-in center and about the village, because it takes a village. It takes so many different resources to come together to help out. Thank you.
Yeah.
All right, up next we have Ryan Bell from Community Outreach for PATH. Ryan Bell, thank you, sir, for coming. You have the floor, Mr. Bell.
Thank you, everyone. Nice to be here with you. Appreciate the invitation to come and share with you a little bit about what PATH does in ending homelessness in Los Angeles and around Southern California. PATH just celebrated its 30th anniversary of serving the homeless population in Los Angeles. It started in a big church in Westwood, and very quickly became its own separate nonprofit, and for 30 years has grown with the whole industry of serving and ending homelessness, from emergency shelter and food to then temporary housing to permanent housing, and now beginning to think about what it means to build community in our neighborhoods to reconnect the fabric of society for people who have been homeless. We have 22 locations from San Diego to San Luis Obispo, and we've grown very rapidly over the last few years because of some of the programs that you've heard about earlier this evening with the Veterans Administration, the VASH program. Our case managers manage a number of those VASH clients. We have, in the last 2 years, housed about 3,600 people. Some, when we categorize them in 3 ways: chronic individuals, veterans, and families. And our CEO, Joel Roberts, set a goal that we would try to house 3,000 people by the end of this year. And we beat that goal, and we're just very excited to have made those accomplishments. We do this, as you've heard all the other presenters say, through an approach of integrated services, strategic outreach programs, which I'll talk about more in a minute, permanent housing for the formerly homeless, and rapid rehousing for those that are families as well as people who are at risk of becoming homeless. So our mission at PATH is to end homelessness for individuals and families, but also for communities. And we feel, and you've heard this a number of times from presenters today, that this is a win-win situation for all of us. We can end homelessness for individuals, but we can also end homelessness for communities, and it can be a net gain for the whole community. The emphasis through this coordinated entry plan, the coordinated entry system, is on the most vulnerable individuals. And the way that PATH does this is through an approach of strategic outreach in communities and hotspots where the homeless individuals are living on our streets. And we have a number of contracts with neighborhood councils, like Van Nuys Neighborhood Council. We don't have a contract here, but like neighborhood councils like this, and I'll name a few of those in just a moment. Council districts as well provide resources to PATH to provide outreach services in their neighborhoods in targeted areas. We've talked to Barnsdall Park as a private nonprofit about servicing them. We're not quite there yet, but we do talk to a variety of types of organizations to provide outreach in their neighborhoods and around the community. BIDS as another business improvement districts as another approach that we take to resourcing our outreach teams. We focus on housing, as everyone else has said, and we have wraparound services to make sure that people stay housed. Another aspect of PATH is PATH Ventures, where we build housing from the ground up, but many of our clients are engaged in scattered site locations where, through the use of vouchers and other programs, our clients are able to secure housing in neighborhoods around the city and around Southern California. And our ultimate goal is to have individuals reintegrated back into communities so that they become taxpayers again and become supportive of the whole community that we're a part of. That's our goal for them through work and through volunteerism. We've even been talking about how some of our success stories, some of the clients that have been housed through our programs can then become volunteers in our programs, and we already have a few people beginning to do that, giving back to the very programs that have helped them. Our approach is through integrated, customized approach to case management. So we talk about thousands and thousands of homeless individuals in Los Angeles County, but when it comes down to case management, it's one person at a time. We were talking to a group of students from UCLA that were doing a project, and they said, well, how, basically, like, what's the plan? And we said, well, there's this kind of, elements of this plan, but literally every person that presents to one of our programs, one of our case managers, is an individual, and they have a story and barriers, unique barriers to housing that have to be addressed. And so our case managers create individual service plans that are designed to help those people overcome those barriers to housing and ultimately find their way to a permanent housing solution. And those barriers, as you heard tonight, include mental health issues, physical health issues, substance abuse, employment, skills development, and ultimately community integration. So our outreach programs are simple but powerful. We send outreach workers, trained professionals, out 2 by 2 into communities, in particular in hotspot locations around our city, and just begin to engage them on a one-to-one basis, building trust, building rapport, and inviting them to engage in whatever services seem appropriate for that person. We may invite them to come inside into a shelter. Some people really do not want to be in a shelter, and I think you can understand why that is. And so we've worked with some individuals who are ready to move directly into permanent housing from the street. Other people can engage in other types of service programs, and because of CES, we're much better connected to one another, and we can refer people to programs that specifically suit their needs in helping them overcome the barriers that they have to housing. We've sometimes worked with people who've been on the street for decades, and it literally takes years to build their trust enough that they'll even let us, one of our outreach workers, take them to the doctor, or take them to DPSS for a meeting to get some benefits that they are entitled to. So we have outreach teams that connect people to case management, emergency housing solutions if they're open to that and need that, permanent housing location, employment services, and ongoing supportive services once they're housed so that they can retain the housing that they've gained. There's nothing more disheartening than watching a person gain permanent housing and then lose it. And it happens, but we try to prevent that by walking with them through those early stages of getting used to being in housing. One of the things we also observe is that when we bring a person in and we help them locate permanent housing, they move in, and our volunteers do a great job of providing move-in kits, whether it be small items like kitchen essentials to larger items like furniture. We help them integrate into a new apartment setting. But guess what? We've just uprooted them from their community. Their community, their support system was on the street, or was in the shelter, or was in some other kind of network. And so one of our goals now is to help them build networks, social networks like each of us have, where we can reach out to a friend if we're having a bad day, or we have somebody that we can call if we need some help with something. We've discovered that the best way for communities like Van Nuys or any community to address homelessness is through every part of that community working together in a holistic way. The faith community, the nonprofit community, businesses, government entities, law enforcement, everyone at the table. Otherwise, it's just a fragmented approach, and we've tried that for so long, and it doesn't work. And so we have outreach contracts with neighborhood councils, including Rampart, Silver Lake, Los Feliz. We're working in East Hollywood, Venice, West LA, in the Westwood bid in particular, Central San Pedro, Pacific Palisades, and others. And in city council districts 4, 11, and 13, we also receive some funding to provide outreach services, and we receive our directions then directly from council offices about where certain hotspots are. We found that businesses, faith communities, individuals, when you encounter someone who's homeless, you want to do something to be supportive and helpful. And if you're like me, you don't always know what to do, or if the thing that you feel like you're about to do is the right thing to do. And so businesses and neighborhood councils would have a number they can call, and one of our outreach workers will get out there and meet with that person, talk to them, and see if we can help them take the next step towards becoming stable in housing again. So thanks for letting me share, and would be more than happy to answer questions later on and follow up with you. Thank you.
All right, up next we have Wade Trimmer from the San Fernando Valley Rescue Mission. Wade, thank you very much for coming and doing this.
Well, good evening. I'm Wade Trimmer. I'm the director of the San Fernando Valley Rescue Mission. We have a family shelter in Northridge. It used to be in North Hollywood, but we burned down earlier this year. Thankfully, nobody was injured in that fire. So we moved to Northridge. We serve homeless families. We also serve the chronically homeless by providing them with showers. We have a mobile shower unit that goes throughout the valley to provide that service. And hot meals, and that is a cute dog. And the end game for us, when I first came to the organization, actually I'll back up a little bit. 22 years ago I was in Westwood waiting to see a movie, and I was approached by a 12-year-old girl who shared with me that she was homeless, and she was asking me for food. And I had never met a homeless young person before. I grew up in northern New Mexico, where there's a lot of reservations, and there are a lot of older homeless individuals who tend to be addicted to alcohol and things. But I had never met a homeless kid before. So her name was Angel. She ruined my life that night. I was supposed to be an architect. And she ruined my life in the best of ways because Angel really inspired me and inspires me every day to do the work that I do. So for 22 years I've been kind of at this issue, but it's not an issue. And it just bothers me that